thesis is secondary analysis and quantitative and qualitative data gathered for study of intimate partner violence perpetration among males receiving substance use treatment. My presentation will follow this outline. Firstly, I'll explain the background and the aims of this study. Secondly, I'll explain the methods of both quantitative and qualitative study. Thirdly, each set of results will be presented separately. In the discussion part, I will offer an interpretation of these results. Lastly, I'll give you a brief conclusion. First of all, intimate partner violence, or IPV, refers to a domestic violence and abuse within an intimate relationship. IPV is a global health issue causing acute or chronic negative consequences, including depression, anxiety, post-traumatic stress disorder, and sexually transmitted infection. In 2008, the annual financial cost related to IPV was estimated to be £15.7 billion in the UK alone. According to the latest crime survey for England and Wales, the lifetime prevalence of IPV victimization was 27.1% for women. What's more, a recent WHO analysis concluded that roughly one-third of women across the world have experienced IPV perpetration. It's been established that IPV perpetrators are overrepresented among males receiving substance use treatment. As you can see, 58% for people in methadone treatment, 4 to 6 times higher among alcoholic samples, and 77.3% for males receiving substance use treatment in England have perpetrated some form of IPV. There are several current clinical issues that stand out in terms of IPV. Perpetrators attend perpetrator programs because of court orders rather than doing so voluntarily. As a result, are highly likely to drop out. Those programs are barely scratching the surface of the population of men who require these interventions. Campbell et al. Investigated male perpetrators and found that most of them considered doctors and counselors as being the best resources for help due to the strict confidentiality of their profession. Given the high prevalence of IPV perpetrators and preference for health professionals, we can consider that substance use treatment setting is a promising venue for the identification of IPV cases. However, further research into health-seeking behaviors is necessary. That's why the aims of this study are to address the following research questions. First, what proportion of IPV perpetrators disclose their perpetration or sought help? Second, who did perpetrators disclose their perpetration to and from where did they seek help? Third, which variables are associated with the likelihood of disclosure or seeking help? Or what kind of factors can be barriers to help seeking? The hypothesis of this study is that masculinity would be associated with the low likelihood of male-seeking behavior, because a body of studies have revealed that this factor decreases male health-seeking behaviors. In this study, a mixed methods design was used in order to gain a comprehensive understanding of health-seeking. A subsample of male IPV perpetrators receiving substance use treatment in England was analyzed. I conducted descriptive analysis and explored factors associated with the likelihood of health-seeking behavior. I also analyzed the 27 structured interviews. I imported those transcripts into NVivo 11 and read through them line by line at first. They conducted open coding, allocating each code a label to describe each separate topic. Finally, I merged them into 6 main themes. Next, I'd like to move on to the results. This table shows the characteristics of participants. Their mean age was 42.2. They were predominantly heterosexual, born in the UK and foreign. The majority of them are employed or receiving benefits. A large proportion are also homeless. As you can see, just over half of respondents reported that they had told their perpetration to someone, among which 38 participants reported that they had sought help from someone. They disclosed their perpetration to friends most of all, followed by family members, and then health professionals. The majority of numbers of participants had sought help from health professionals. The number of participants who had sought help from family, friends, or police were simply 9. To sum up, just about half of the respondents had confided their perpetration, and that only about 1/4 of them had actually sought help. While they tend to disclose their perpetration to informal resources such as family and friends, they actually seek help from formal resources such as health professionals. The results of the questions as to why they did not disclose or why they did not seek help were quite similar. The majority of them chose feeling embarrassed, ashamed, would not be believed, followed by feeling violence is normal, not serious. As you can see in the final model, these three variables remain significant. These findings mean that perpetrators who are unemployed receiving benefits are far less likely to disclose their perpetration, whereas physical perpetrators and those who have been arrested for IP perpetration are less likely to disclose their perpetration. With regard to variables associated with seeking help, I calculated adjusted odds ratio only by age and ethnicity because of the small sample size. This table shows 4 identified predictive variables. These findings mean that perpetrators who were hepatitis C seropositive or had been arrested for possession or dealing drugs, or had physical fight with another man in the past 12 months, are less likely to seek help for their IP perpetration. On the other hand, perpetrators with a high score in gender relations, in other words, perpetrators who support gender equitable norms, are more likely to seek help. I analyzed 20 transcripts by coding using NVivo. 6 main themes regarding disclosure and help seeking for IP perpetration emerged. Interestingly, among 6 themes, these 3 themes were the same as the answers of the quantitative study. Now I'll discuss the remaining 3. Men did not feel that substance use treatment is the place from where they can seek help. Even when rapport with service staff seemed to be good, the topic of intimate relationship problems was rarely brought up by either male perpetrators and staff. This is perfectly highlighted by these quotes from William and Billy. Men felt that greater expertise or knowledge is necessary among substance use treatment staff. Staff without sufficient knowledge of how to address IPV issues tend not to deal with IPV perpetration within their routine work. Even when they were directly approached, they seem to tightly focus on substance use treatment. The lack of knowledge is summed up by Billy's comment here. Here, Christopher insisted that men sometimes need to express their aggression in order to avoid being the target of bullying or seen as weak in a male hierarchical society, such as prison. Anger management programs often contradict a male stereotype and aggressive behaviors. That a prison life reinforces, making it difficult for IP perpetrators to engage in wholeheartedly. In other words, the concept of hegemonic masculinity is more dominant in the criminal justice system than in society generally. This brings us to the discussion. The quantitative studies show that about half of the participants had disclosed their perpetration, and only 1/4 of them had sought help. Determining whether these figures are high or low requires careful consideration because little comparable data exists. The prevalence of 63% for seeking help among men prior to attending to a community perpetrator program may imply that the rate of help seeking found in the current study is low. This study also identified several factors which may increase or decrease the likelihood of seeking help. So, how should we interpret these findings? Obviously, we need to bear in mind it's unclear whether these disclosures were done voluntarily or not. Some perpetrators arrested for IPV perpetration would have needed to disclose their perpetration to police during any related investigation. And perpetrators who are unemployed or receive benefits may be isolated and lacking in social networks in which to confide. The findings that supporting gender equitable norms was identified as a facilitating factor, and having had physical fight with other men was identified as an inhibitory factor, is compatible with the concept that conforming to masculinity decreases male health-seeking behavior. Perpetrators who are hepatitis C seropositive have currently or previously injected drugs, and thus are highly stigmatized and may perceive it difficult to engage with health services. Perpetrators who have been arrested for drug possession or dealing might feel shame and embarrassment, which in turn deters them from seeking help. The quantitative study shows that health professionals are perceived as likely resources for IPV perpetration. The qualitative study suggested the necessity of greater expertise or knowledge among substance use treatment staff. Given the high prevalence of IPV perpetrators among substance use treatment, Staff in these settings need to be equipped to address IPV. With regard to primary care settings, it was found that most males accepted being asked about IPV issues by health professionals. Furthermore, a training program was developed for primary care staff that effectively increased the rate of identification of female victims of IPV and refers to violence advocacies. Thus, further research on males' acceptability of being asked and the development of a training program for substance use treatment staff are needed. This study has several limitations. First, these findings of this study might not be generalizable outside England. Second, the sample size is small. Third, it's unclear whether help had been sought voluntarily or mandated. Fourth, due to recall bias, help-seeking behaviors might be underreported. Lastly, because of the cross-section design, causal relationship is uncertain. Despite these limitations, this is the first mixed method study to investigate health-seeking behaviors for IP perpetration and on males receiving substance use treatment. Thus, this study provides a basic information for further research. So, in conclusion, further research on men's attitudes towards being asked about IPV issues is warranted in order to increase the identification, increase the disclosure and the help seeking by male perpetrators. Substance use treatment staff should be trained in how to ask or how to respond to their disclosures. Finally, a training program should address a range of the barriers identified in this study. Thank you for your time and for listening.